بسم الله الرحمن الرحيم. السلام عليكم. اليوم هيكون معنا مراجعة بسيطة final review for oral medicine part 2 which is for semester 10. The exam will be of almost 40 questions and the exam duration is 1.5 hours. Good luck for everyone. This revision is prepared by me, Dr. Iman Sheikh. Okay, regarding the drug-related oral conditions, we need to know the drugs and their effect on the oral cavity. For example, the phenytoin is commonly called the gingival hyperplasia, which is a drug of responsibility, the most one, which is phenytoin. It's anti-epileptic, okay? Then the metronidazole and warfarin, the combination between them can uses the use can increases the bleeding risk. Okay, so it must be avoided. We need to know the drug and their effects. Okay, you had also the nystatin and the chloroquine and the calcium channel blockers. There are common drugs. We had covered them during the lectures, especially the drug-related oral conditions. Okay, you need to make a good revision for this one. Okay, the painful and autoimmune oral lesions, starting by the erythema multiforme, pemphigus vulgaris, and burning mouth syndrome, and primary herpetic gingivitis. I know that erythema multiforme had been covered in the semester 9 also, and there is 10, so it will be easy for you to remember. We had in erythema multiforme sudden painful ulcers, target lesions in the skin, and it's acute. It's a disease of acute onset, which is very important to remember. Also in the pemphigus vulgaris, it's autoimmune. It's related to you need to remember the sign and symptoms and the erosion lesions. We had erosion lesion, not ulcerative lesions. Okay, you need to focus at this point also, and you need to revise the sign and symptoms in addition to the Nikolsky sign, which is positive in the pemphigus vulgaris especially. Okay, another condition which is painful, it's a burning mouth syndrome, which is associated sometimes with the iron deficiency anemia or some conditions, but for most of the patients there is no reason, and you have to know it's not related to any infection. Okay, the primary herpetic gingivitis, which is viral infection, is painful vesicles, fever, typically in young patients. You can find a child or teenager or younger patients. Okay, we also discussed the infectious diseases and immune disorders. You have tuberculosis, sarcoidosis, Kaposi sarcoma, and candidiasis. Okay, you need to remember or to revise the special characteristic either in the diagnosis or sign and symptoms. Okay, and you can use those notes as a guidance. Also, systemic and genetic syndromes, Addison disease, Betz-Jeghers syndrome, or facial granulomatosis, systemic lupus erythematosus also, which is the butterfly rash, oral ulcer, affects skin, multiple organs. There is a clinical note, always consider systemic manifestation when diagnosing oral pigmentation pattern. Don't make that diagnosis localized in the oral cavity only. Okay, also you need to revise the salivary gland and mucosal pathologies. You have ranula, sialulitis, and alcoholic sialidinosis. Okay, and you have here the key diagnostic feature management, and you need to revise more information in the lecture of the oral swelling. Okay, related to the orofacial pain, neurological and pain syndrome, we have trigeminal neuralgia and glossopharyngeal neuralgia. We discussed both and we know the difference between them. Okay, the trigeminal neuralgia, you are focusing on the branches of the trigeminal nerve and their supply area, the ophthalmic branch and the maxillary branch and also mandibular one. And the characteristic of the pain is different for both of them. Electric shock like pain, which is for trigeminal neuralgia, which is sudden pain in a second. Okay, you need to remember those, and often misdiagnosed as dental abscess. And the glossopharyngeal neuralgia is related to the area supplied by the glossopharyngeal neuralgia, which is the ear and throat and the posterior tongue area. Okay, so it will affect the swallowing and the yawing, so you need to focus on the clinical features. Also, the common treatment options is the carbamazepine, which is the first line medication for the trigeminal neuralgia, and the gabapentin. It's the second option. Also, there is microvascular decompression, which is a surgical option. Need to refer to the oral maxillofacial surgeon. Okay, we need also to revise the preoperative and systemic consideration, prosthetic heart valve, and the chronic renal failure, also long term of the corticosteroid use. Okay, I have wrote everything here to guide you for what to revision regarding this topic. Other important conditions and lesions: oral submucous fibrosis, which is a pre-malignant condition caused by beta nut chewing. We need to know the clinical features, also the management. The squamous cell carcinoma, it's a chronic tongue ulcer, commonly affecting the tongue. Okay, you need to know the location. And the predisposing factor, which is betel net, is a significant risk factor. Also, another condition, which is pyogenic granuloma. The area will bleed easily, and there is a rapid capillary proliferation. Also, one of the condition which is important to know, which is amalgam tattoo. You need to know the description, which is blue-black pigmentation on the buccal mucosa due to dental amalgam, and you need to know how to differentiate it from other differential diagnosis related to this area, the pigmentation in the cheek and buccal mucosa inside the oral cavity. And the lichen planus may transform into squamous cell carcinoma, and you need to know the clinical feature of this lesion, which is Wickham ray. The risk factors of the oral cancer must be known for you. They are tobacco, alcohol, betel nut, human papillomavirus, and UV exposure. The images in the slides are good for more focusing and to remember the condition by the photos. There are no photos in the exam, just for your information. There is nutritional deficiencies. We need to consider also the vitamin B12 deficiency. It will lead to angular cheilitis and glossitis. Also, vitamin C deficiency can cause bleeding gum, not pigmentation. And you need to revise this table. It will help you. Okay, a quick recap for the key takeaways and study tips. The key diagnostic features focus on the characteristic appearance of the lesions, color, texture, and location. Remember age and gender predilections for different conditions, and pay attention to associated symptoms and systemic manifestations. the oral manifestation of systemic diseases. Okay, they considered the medication history for drug-induced condition, and for your study in this short time, effective study strategies create comparison tables for similar conditions and practice case-based scenario with the clinical MS. You need to know the signs and symptoms to make the good diagnosis for the disease. And when you know the diagnosis, you need to know what is a suitable or the drug option or the drug of choice or the first line of the treatment for the case. Use mnemonic for complex drug interaction and syndromes. You can make some tables or boxes, and you can make a figure out for your notes, and review the management protocols for common emergencies. Okay, last but not the least, remember to correlate clinical findings with patient history for accurate diagnosis. Good luck for everyone, and remember, you are future dentist. Thank you. Good luck again.